The Healthcare Training Institute started in 2008 as a collaboration between several area hospitals and JVS as a training partner. And so we essentially came in and helped the employers identify what their specific workforce needs were and created customized programs to address it.
When I started to work at Brigham and Women's Hospital, I heard about these classes and I decided to take it because I want to improve my English.
I want to communicate with my boss, my supervisor, the student, and my coworker also.
Sometimes I have replied the email from the doctor, or some transcription message, I have to send the email to doctor to confirm.
There's more and more that's being asked of entry-level employees, so I think that now more than ever, HTI is well positioned to drive at those critical workforce needs and evolve with these organizations.
I take computer class, how to use email.
Folks who used to only need a high school education or less than that are now being asked to, use computers for every piece of their job.
And now they can send email to their supervisors, they can check their payroll, they have the skills and they have the confidence.
What we try to do in the classes is really bring the practice of the language skills that they're going to use on the job into a safe environment where they can make mistakes, ask questions.
Used to my boss always correct me after the writing email, but still now she's still helping me, but I feel she correct less than used to be.
Now I feel more confident talking with my kids, help them with their homework at work. I feel more comfortable to talk with the patient and make questions to the nurses.
When I listen to the phone, I don't feel shaking anymore because I take this class.
When students can critically think, problem solve, and communicate, they become more confident in themselves and also more valuable employees.
I really enjoy seeing staff coming into my department that they can move to something better.
What we've noticed from the employees taking the classes is a greater career advancement within the hospital. There's just more opportunities for them to be able to extend their career beyond support services.
By taking this class, English, math, the preparation to college, I have knowledge to do something different from before.
These programs are funded mostly through the employers themselves and also in large part through SkillWorks, which is a funding collaborative based out of the Boston Foundation. SkillWorks really initiated the relationship back in 2008 and now funds the academic coaching services that we offer.
Within the JVS network, we have coaches who are assigned to clients who are going to go to college. We're thinking about, starting with thinking about what career goals they have, and then helping them to decide, all right, so if that's what you want to be, how will you get there?
The ones who's taking these classes, they are the one who want to grow, and they're the one who are participating in all the programs.
Aguinaldo always had a drive to better himself, and then providing classes for him allowed him the vehicle to be able to bring these skills back.
He showed me a stack of papers like this of all the credentials that he brought from his home country. He'd actually gone to school.
The staff that usually work for us are probably well educated back in their home countries, and then because of their English skills, they're unable to really gain a job that they're suited to do.
We went through that process with getting his credentials evaluated, and whenever they came back and said that he actually would be eligible to transfer some of his credits, he was ecstatic.
Now I'm seeing myself in a way I didn't think I should be there, but again, thanks JVS program, I'm there. I want to see how far I can go.
He'd had these papers for a long time, and he just wasn't able to believe that that they meant anything in this country.
As of 2014, I started taking course in Bank Community College.
He's a man on fire. I mean, he's very soft-spoken, but there is a flame burning in there.
My plan is continue working with them. When I finish my course, I prefer to work as an IT department in Children's Hospital.
When you help them to move to a better job, at the same time you're helping the institution, you're helping the hospital.
They feel their employer is invested in them, and in turn they want to stay invested in the place where they work.
It's not just a job anymore, it's really a place where they can develop themselves, where they're supported to grow. They realize that the hospitals invest money in these classes for them. They're very aware of that fact, and they're very conscientious about attending class, about following through with the work and trying to use the language that they're learning on the floor and actually put it into practice.
They feel recognized. You know, these classes are free to them, and that's huge. A lot of people wouldn't be able to take advantage of a class if they had to pay for it out of pocket.
I'm very thankful to get the class because it's more close to get the work.
They just get out of work, they walk right down the street, and we're right here waiting for them.
I never had this opportunity before, and I feel so happy, and I want to continue studying and learning English.
All of them always, at the end of the year, want to write thank you letters to their supervisors for sending them to class. They want to thank their hospital.
I really appreciate it, what the JVS offer the program, what the hospital provides, have an opportunity to learn.
We've worked with over 2,200 people in the last 7 years, and the momentum keeps building, and I really am so excited to be a part of an organization and a partnership that has such great vision.
In my heart, I really want to learn more because I'm the mother. I'm also working at BI.
Some of them are working 2 and 3 jobs or raising children. They never had a chance before to study the language.
If somebody says, you know, like JVS comes in and looks around and says that there's a lot of potential here, and the employer says, let's untap it, that's magic.
I sacrifice, then I deal with myself because I want to see myself in different positions. So it's kind of hard, but now I feel a little elevate when I receive my diplomas and certificate in hand. Yeah, I have approval. Here is a lot certificate and programs already I have from JVS. So I keep it as my record for the rest of my life.